Hey everyone, this is part two to my two-part series of the wrist joint. Welcome back. I don't know about you guys, but if you ever had tendinitis, oh my God, it's one of the most painful, frustrating things to ever have to go through, especially if you play a really wrist-on sport, uh, like volleyball, like what I played. It hurts so much, and it took like 6 months to heal. But yeah, I just wanted to pop in to say that. Also, how are you guys doing? Anyways, let's continue. One of the most common wrist injuries is tendinitis. Tendinitis is the inflammation of a tendon, and it's due to a person's overuse or injury of the tendon. There are several wrist tendons that surround the wrist and could become inflamed. These tendons control the movements in the wrist, hands, and fingers, which is why tendinitis is such a tedious, annoying injury. There are several ways to treat tendinitis, such as using splints and compressions, braces, pain meds, hot and cold therapy, and in rare cases, surgery where they increase the space between the tendons. For rehabilitation, some patients will use isometric exercises that can help reduce the pain, such as flexing and extending the wrist. There are ways to prevent tendinitis. Don't let it get the best of you. You can improve your technique, stretch before and after, and prepare muscles to play, or you could avoid excessive stress on the tendon, so you might want to sit out 1 or 2 times to let it heal. The next common injury of the wrist is a fracture, specifically the distal radius fracture, which is a fracture of the thicker of the two bones, the radius. It usually occurs about 1 inch from the bone, and a common type of fracture is a Cole's fracture as pictured here. This is when the broken end of the radius tilts upwards. This injury can occur if you're involved in an accident such as falling off of your bike or from playing a sport like basketball. It can also happen to someone suffering from osteoporosis. One must seek attention immediately in order to get the bone back into proper place and position. A doctor will do this by A, if in good condition, doctors will put a cast on the wrist to realign the broken bone fragments, or B, surgical treatment where they could place a metal plate at the bone to correctly align the bones again while it heals. Rehab is a must and will be further determined what exactly is to be done by the doctor. The last injury of the wrist is a sprain. This is an extremely common injury amongst the athletes or anyone that engages in physical activity. The cause of a sprain is when you catch yourself with your hands as you fall on the hard floor. The force of impact bends it backwards towards your forearm. This can stretch the ligament that connects the wrist and hand bones a little too far, also caused by twisting it or being hit in the wrist. Following the Rice method will help treat the sprain. Thank you guys for listening to my presentation.